is so jealous that I get to talk to you. And you don't even talk about my son. He can't believe it.
Oh man, it's my honor. Absolutely, it's my
Yeah.
honor for sure.
Thank
Thank you for taking this time though, for sure.
It's a pleasure. Thank you.
I think it's kind of these conversations and uh, talks and get-togethers, and trying to tap into other people's mind and opinions is very much needed today. And I think we need to do more of kind of these conversations and have this dialogue, open dialogue, honest dialogue about just the state of where we at as a whole. So again, thank you for kind of taking this time.
My pleasure. Thanks for using your platform to get messaging out.
Yeah, I mean it's that's what it's for, right? We have to adjust, we have to adapt to kind of what's going on today, and we all affected by what's going on. Whether it's us personally or people that surround us, or people that we know, and so we're all being affected by what's going on.
Yeah, yeah.
So I just we can jump straight into it. There's been a lot of pushback about the discussion of the virus and how it affects communities,
Yeah.
in particular, communities of color. And I just want to start off by saying that those who have lost friends and family members, the loss is real. We know, and it's painful. By no means are we making one less more severe than others. So what we're talking about, however, is why are people of color dying faster than everyone else, and what could be done to slow the effects of this virus in these communities. So, with that being said, Michelle, can you please tell us a little bit about yourself and how you became interested in the public health field?
I'm Michelle Williams. I'm Dean of the Faculty at the Harvard T.H. Chan School of Public Health. I am an epidemiologist, and my area of research is in maternal and child health. And I am a proud member of a team of investigators and collaborators who developed First Responders First. This is a program that was designed by the Harvard Chan School of Public Health, Thrive Global with Ariana Huffington, and the CAA Foundation. And I couldn't be more proud to be part of a group that represents scientists, industrial giants, as well as academics who are focused on protecting, preserving, and supporting first responders. Now, during the time of COVID, and enduringly, even when we are outside of COVID, first responders need to be supported, need to be celebrated, and need to be recognized for all that they do in support of public health and global health. And I've been involved in public health as an academic, first as a professor, then as a department chair, and now as the dean of the Harvard Chan School of Public Health, where I work with people who are using the best of science and evidence to bring that knowledge to bear on solving major public health problems. And we are addressing a major public health problem right now with the COVID-19 pandemic. And as you alluded to, one of the things we have seen all too painfully is that Black and brown people are suffering disproportionately from a virus that does not discriminate, a virus that does not respect borders or boundaries. But still, because of structural inequalities like access to good quality housing, access to quality, speedy, non-judgmental healthcare, historical, structural lack of access for opportunities, jobs that would actually allow people to work from home. I mean, it's hard when you are a low-wage person who has to go to work and has no option of working remotely to stay out of harm's way and still earn a living for your family. And so this is a kind of virus and a pandemic that uncovered what was already there in terms of economic, social inequalities that have historically impacted Black and brown people, immigrants, but really also just poverty. People who don't have the wherewithal, the wealth, the income to get themselves out of harm's way in a way that others with resources can.
Makes sense.
Sorry, go. I just wanted to say public health, what we do in public health is try to look at the problem in a 360 way. And there really is never any one answer. It's a number of complicated factors that come together. And I think that's what we're seeing unfold as we look at disparities in the way COVID has really had a disproportionate impact on Black and Brown communities in this country. And increasingly, also, I have to say, in Native American communities, like the Navajo Nation that we've been hearing about all week.
What could you explain that actually was great insight. Could you explain just for the viewers who's watching what public health covers?
Yeah.
Because I feel like people don't really understand what people who specialize in this space are focused on and the impact it has on our world. Yeah. So I think this is a great time to kind of educate and possibly encourage some of our, I would say, younger people today to go into these fields as they pursue their educational goals at the end of the day.
Yeah. So public health is an evidence-based, science-based field that addresses, unlike medicine, which takes care of an individual patient at a time, public health is looking at a whole ecosystem. Public health is looking at, what are the factors that impact health and wellness across the board. Public health, when you think about it, ranges from ensuring that we have the best science that might help us create treatments and therapeutics and diagnostics, all the way to making sure that those therapeutics and diagnostics reach the populations that need it the most, and everything in between. So public health will, I'll tell you, public health is making sure people were wearing seatbelts and wearing bicycle helmets because we needed to protect individuals who were having premature mortality because of head injuries that could be prevented. Public health takes a look at how people live, where they work, where they learn, where they play, and try to develop an environment and an ecosystem that supports and enables full development of human potential. Public health is when your water that comes out of your pipe is free of lead. Let's talk about Flint, Michigan. Public health is there to do the surveillance, to identify what the threats are, and there to bring about, the factors that can either increase or decrease risk. And if we can decrease risk, that's public health. Public health is making sure that we have the right evidence available for making sure school lunches are nutritious and provided to those who need them. Public health is when you get in your car and you're driving, at the speed limit, the roads are designed to decrease the likelihood of a traffic accident. It's the science that helps us understand how to build safe buildings and use fabrics and designs of furnitures that are optimal for the needs of people to perform and function normally. Public health is understanding, what are the factors that contribute to disparities in birth outcomes for African American moms versus Hispanic versus white moms. And once you find out what those factors are, public health is dedicated, devoted to taking down those risk factors and trying to bring equity in health outcomes for all. Public health, I like to say, is the science where you connect the dots.
Yes.
Where when the dots are connected, you identify the problem. You then work to identify solutions, and you try to create a healthy environment unscaled. Public health for me is about science and social justice. You look for where you can do good to support the betterment and the optimal development of people everywhere. It's local as well as it's global. Public health is trying to reduce the burden of violence in our communities. Public health is where we look at the data and we show that there is a disproportionate burden of violence in our Black and Brown communities that is in part due to the structural way policing is done, and it brings the evidence about that says we've got to make changes in these communities about how we do policing. Public health is looking at food insecurity and housing insecurity and connecting the dots that those two insecurities contribute to a high burden of hypertension and diabetes, and other chronic diseases in our population. Public health is identifying the fact that chronic lung disease is preventable if we would provide better, safer housing for our low-income kids who are growing up in environments where dust mites and other environmental contaminants increase the risk for asthma.
Those answers are like they pinpoint every single aspect of what public health is, right? And I don't think people understand exactly the realms of public health, so to say. When you hear public health, you're thinking maybe one or two particular things, and what you just explained just took you across the board, and I think it's very insightful to people who's watching, and just people in general who they constantly keep hearing public health, public health, public health, but really do not understand or know, or might not be educated or getting the right information about exactly what public health is. So, for me, that was a great explanation. Even for myself, this is educational for me as well. Could you talk about how COVID is affecting, of course, communities of color from your perspective? And but people have theories, but considering that you have studied various diseases globally, me personally would love to hear your position on this.
Yeah. First, let me say COVID is affecting all of us, but as we watched this epidemic travel across the globe, I know that one of the things I now recognize in hindsight, and we were talking about this among our colleagues at the Harvard School of Public Health, is that we watched Black and brown communities not hear about the true health risks of COVID because we were not on point in messaging the risks to communities in ways that they could hear it, understand it, and appreciate that they were at risk. At first, the message was about, it's for people who travel. It never really got down to the level of, this is a community spreading virus. And if you are, in the vicinity of people who have the infection, you are going to be at risk. It has no racial, ethnic, or geographic boundaries. The other thing that I think was the messenger. So when we started talking about the risk for severe disease, we kept saying it's for older individuals. And that is true on a population level.
Yes.
But what we missed communicating, particularly to minority communities where there's a high burden of non-communicable chronic diseases like diabetes and hypertension and heart disease, is that it's not just about your age, it's about your general health conditions. And if you had some of these other comorbid conditions, you were going to be at risk. And it took a while for us to get the messaging right. And the delay, unfortunately, I think impacted Black and brown communities. But the economic problems. I mean, when we saw people work remotely, if a high proportion of Black and brown folks don't have jobs that accommodate working remotely and staying employed, then there becomes this very difficult choice between earning a living and actually partaking in the public health intervention of working remotely. And again, these are some of the structural issues that added to the burden. The historical issues too. I mean, we hear stories about folks going in for testing with symptoms and not getting tested, being sent home. And testing centers, when they were first being set up, they were not being set up in low-income communities. And that disproportionately led to an underutilization and a lack of access for timely testing for COVID in Black and brown and low-income communities.
To me, that's I think that's what I was looking for to hear. And I mean, we all know that it's affecting, not just communities of color, but all communities, and we're well aware of that, and we're very cognizant of that. But to the point that you made about uh, the communities of color got their resources and the information a little bit later than everybody else, has caused a mass hysteria in those communities, in our communities, and the lack of information that we receive, the lack of education we receive, and just leaving us to the unknown of what's the possibilities, what can happen. Because, like you said before, early it was just um, elderly people, and then it started trickling down, and then once it hit the community of color, and then now kids and animals. So it's constant information out there, but a lot of people don't really understand what's the right or wrong information. I think now everybody's just going off of feelings, emotions. I don't think they willing to trust the information that's being told to them right now. So people are just kind of making their own decisions, and also emotionally and mentally, people are just tired of it. It's like they're fed up. Like, we're not getting the right information, so we're gonna do what we want to do. We're gonna step outside. It's tired of being in the house, and that is an effect that will affect us long after this COVID and quarantine is over, because mentally we will all be impacted in some way.
Yeah.
So with that saying, what can we do
Yeah.
to slow the virus down, and I don't want to say just in our communities, but in all communities. Like,
Yeah.
how can we slow the virus down?
Yeah. So that's a great question. Thanks for asking that, Carmelo. And it really is a universal response that is needed. And it's got to be very clear communication. The things that we can do to slow this virus down is to really comply with the request and the mandate for social, or what is called physical distancing. The way this virus spreads is from person to person. And what this means is we have to create distance that allows to break the transmission chain of the virus. So the social distancing intervention is our best bet given the scope of this pandemic. And we've actually seen the benefits. We've seen what people are calling the flattening of the curve. By reducing the transmission, we reduce the number of individuals who catch the virus and then go on to have severe illness that requires hospitalization and ventilation use. And so social distancing is enormous. The other things that we have been doing to some measure of great success is encouraging people to wash their hands, to keep their hands and their hands away from their face, minimizing transmission. And also now increasingly, as we see some states that are opening up and loosening up again, that they wear masks and keep the priority towards social distancing. There's a great need for people to remain connected. Social isolation is not a good thing. Social isolation brings loneliness, and loneliness is not good for one's mental health or physical health. And the science is already pretty clear that we as humans need social engagement and social interaction. But we have to do that recognizing that by being physically close, we increase the risk for disease transmission, and we want to bring it down. So social distancing or physical distancing, washing hands, doing as much as we can to prevent the spread by wearing masks, and really following the guidance and guidelines of our local leaders, our public health officials. I know that there's disinformation going on out there, but go to trusted sources. The Centers for Disease Control is a trusted source, even though they are under some pressures. We've seen governors here, governor in New York, governor in Massachusetts, governor in Washington, governor in California. We've seen some real good, solid leadership from governors. Lori Lightfoot in Chicago, African-American mayor, her first year of leadership in Chicago, and she has just been clear and a powerful voice of wisdom that is guided by science, that is helping Chicagoans manage this pandemic. Um, it's admittedly really sad that misinformation is a part of our narrative. And so, what I would recommend is that, if it sounds illogical, it is illogical. Go to trusted sources like the CDC, the WHO, and if anything sounds too fantastic, double check it. Get a second opinion.
That makes a lot of sense. Thank you for clearing that up. Um, there are now, I mean, new reports that come out almost every day on how children are being affected and different symptoms that are surfacing. Again, I think it comes down on slowing the spread of virus. But can you please give us your professional take on that? People are scared and want to protect their families, and it'd be interesting to hear what you have to say about that. Could you talk to about
Yeah.
that?
So, we're learning every day something new about this virus. We are, and that is the nature of science. I mean, science is an empirical based process where we learn from collecting information and analyzing the information, and really being very thoughtful that we are learning from everyday experiences. In China, the results that we were seeing from Wuhan were that children over the age of 1 or 2 had really mild symptoms. And that was clearly the reports, and we understood that to be the case. But as this pandemic has unfolded here in the US, we're now seeing in a very small group, it's still a very small group of about 140 kids who are developing this, this really florid Kawasaki disease. It's a disease of the attack of the immune system. And we're seeing this now in about 140 cases so far. We're learning a lot about this, but what I think the take-home message should be is the essential message for everyone. Do everything possible to limit the spread of this disease. And if we do that, we protect the vulnerable, the elderly, the vulnerable, the young children who might be, for whatever combination of reasons, are particularly susceptible to this full-blown, florid, autoimmune response, immune response to the virus, and we'll protect those individuals who have diabetes and are at risk. So the goal is, this is one of the cases where everything we do as individuals, we have a responsibility to individuals outside of our own family and our family members. And, that comes back to, we all have a public health responsibility in this case.
Yes, I would like to add on that. We definitely have a responsibility in everything that's going on. And if we don't do our part as individuals, then we're not going to make any progress.
Yeah.
And I know that there's, just the emotional part of what's going on, and the mental part of what's going on plays a big part and goes hand in hand. So I deal with it on my own sometimes. Just be days where I'm just like, I'm super done. I'm ready for this to be over. But I think we all have to continue to just do the right thing and be supportive of, kind of what's going on. So I thank you for cleaning that up. Another thing, we all know, well, I know that first responders are built differently. I feel like people in spaces where they serve others as a full-time job, it's really a lifestyle at the end of the day.
Yeah.
And whether an ER doctor, a scientist, general healthcare, missionaries, it is a life that chose them, really. Not, they didn't choose that, the life chose them. Beyond the grueling work that this can be, especially in a time like now, how are first responders, I would say, managing mentally?
Yeah. Thank you for that question, Carmelo. And it really shows, just how connected you are, and how thoughtful you are in thinking about first responders. Let me tell you, when I saw this this epidemic unfolding and developing into a pandemic, I worried about first responders, because first responders, and I think about first responders broadly. They are the clinicians, they are the EMS, they are the nurses, the social workers. They are basically everyone who helps us live a normal life, the life we were living pre-COVID. And in other crises, Ebola in 2014 and 2016, we saw first responders suffer disproportionately in catching the disease and dying. But we also saw among the survivors a higher burden of mental illness. And so, in partnership with Ariana Huffington and Thrive Global, her health and wellness tech company, and with Creative Artist Agency Foundation, we created an initiative that was designed to support and help and enable first responders to take care of themselves and to provide resources that they were not being provided in a timely way to help them build the resilience and protect themselves and remain on the front lines to take care of all of the rest of us. As you said, Carmelo, first responders are wired in a way where when we are running away from disasters, they're running towards disasters. And we've sadly lived through this. We've seen this happen in 9/11, right? Who were the people running towards, the crisis? They were our first responders. And there are layers of them. And so we designed this program to honor, to support, and to celebrate them. And, thank you and good prayers are all wonderful, and we appreciate that. But there were tangible things that we saw our first responders needing. They needed to have the protective equipment to be able to do their work and protect themselves. They needed to have the peace of mind knowing that their children were going to receive safe and supportive childcare when childcare centers were closing around, all of the country. They needed to have a safe place to sleep and restore themselves because many of them were sleeping in their cars, afraid that they would be taking the virus home to their family and loved ones. And they needed to be able to have the license to pause, to reflect on their own mental health and well-being and their own wellness. And so we created a program to really address all of these needs, the services and the mental support needed to refuel, to build resilience, and to be able to sustain themselves during what is physically, emotionally, and mentally a very stressful time in their careers. Even before COVID, first responders were stressed with risks of burnout and just the risks of the strain of the work. COVID just added and amplified on the strains that they were experiencing. And I'm actually really proud to say that, with our partners like Bright Horizon, like Marriott and IHG hotels, we've been able to provide really tangible supports for our first responders. In 7 weeks, we raised close to $7 million.
Wow.
That money, and that's thanks to the generosity of a number of corporate partners, individuals, gifts ranging from $10 to $2 million. And I'll tell you, the resources have been put into the full support of our first responders because we believe they are the heroes. They are the ones who are actually helping us manage the burden of illness due to COVID, sustain a health system, and keep the rest of us able to do our part by doing the things that we mentioned: physical distancing, washing hands, doing all the hygiene practices, wearing masks to prevent the spread. And the first responders are really the line between our having a society that continues to function and one that can mend and build its way out of this crisis.
Makes sense.
You asked me about public health, and I'll tell you something about public health. What the world knows about public health now that they didn't know before COVID is that public health plays a central role in our national and global economy, and public health plays a central role in our national and global security. Public health is really the glue, it's the science, it's the evidence-based framework that keeps society humming in the way that we want it to return to.
That and first responders are definitely the heroes. I just want to say that. Um, in closing, I just have one more question. I can sit and talk to you all day.
You're kind.
It's how else beyond I would say the mental our first responders and frontline workers impacted by responding to COVID-19. Like how can we support?
Yeah. Yeah. I think what we should do is, first of all, thank them and recognize the selfless service that they provide every day. And then the other thing I think we should do is to make sure that even when we are out of this crisis, that we support and advocate for and witness all of the help and work that they do, and understand that there are the micro steps that the first responders can do to take care of themselves so that they can continue to work for us. But when we have an opportunity to make known to the people that we vote for, the people that we put and maintain in office, make sure that they understand that we have an imperative to support and enable a workforce, that we should invest in the training, we should invest in the support and the care of a strong workforce that is inclusive, that is diverse and representative, and that workforce should be supported in providing the health and support needed for all stakeholders in society, that it should be an equitable healthcare system, equitable process of providing for housing, secure food supplies, education, and messaging. What you're doing, Carmelo, in using I looked, you have like 9 million followers on Twitter, another 7 million on Instagram. What you're doing is you're amplifying the voices of people like me, an academic who maybe have 10 followers, right?
We're here to help. We're here to help. We're here to help.
Partnerships. What we can do for first responders and for public health in general is to continue to think about partnerships and being really thoughtful about getting the message out that we are all in this together, whether it's gun violence, whether it's domestic violence, whether it's clean water in communities, whether it's protecting our healthcare system by supporting our first responders. I just want to come back in closing to public health covers a broad domain of human life and society. And I just want to appreciate that what we do is we look for problems, we try to find solutions, and it's always evidence-based. It's not political, it is about humanity, and it's universal.
I mean, this is very helpful for myself. I'm sure this will be very helpful for the viewers, people who really want to know more about first responders and how to help or what they can do. The biggest thing, like you said, one of the biggest things that you said is just being thankful, right? Just saying thank you and being appreciative of what the first responders have to go through at the end of the day, because they are the heroes. They on the front line. Their lives has been changed tremendously, drastically, and they're on it, right? They're on it at the front line and doing the things that they have to do and sacrifice. And so, with that, I just want to say thank you for taking the time today, and I appreciate you. It's always great to talk to kind of genius-minded people who really understand kind of what's going on from a ground level, and can easily articulate what's the issues, what's the problems, what's the solutions So I just want to say thank you for that, and I appreciate you taking the time to just talk with me. And you have a partner now. I'm a partner. Let's do some great work. And again, thank you.
Yeah, no, thank you. Thank you again for joining our Leadership Council, for
Yeah,
being such a powerful voice about social justice. And I do very much appreciate everything that you do. And, as someone who grew up in New York, I know you spent a couple of years in Brooklyn,
absolutely.
and, just keep up the great work. I'm a big fan, and I
Thank
appreciate
you.
you.
Thank you. Likewise. I'll talk to you soon.
All right, take care.